My name is Alyssa Harlow, and I'm faculty in the Department of Population and Public Health Sciences at the Keck School of Medicine. My research focuses on understanding trends and health effects of new and emerging nicotine and cannabis products. And really the ultimate goal of my research is to try to identify regulations or policies that we can implement in order to reduce the potential harm of substance use. Primarily, my work to date has really focused on understanding the public health implications of e-cigarettes or vaping. So I became interested in e-cigarettes during my doctoral program because this was really the time when vaping and in particular Juul became really popular among young people. And I was watching with concern as vaping rose in popularity because it really seemed like there was this rapidly evolving marketplace of these novel e-cigarette products that was completely outpacing scientific evidence on the health effects. And so I looked at this and I said, I think this is really an area where we need more people doing rigorous research on the health effects of these new products. I also have always found e-cigarettes to just be a really fascinating public health issue. And that's because they really fall in this space of potential harm reduction for people who smoke cigarettes and may be looking to quit or reduce their cigarette smoking through the use of e-cigarettes. But they of course also pose a number of real harms to youth, and they pose a number of unknown potential health risks to individuals of all ages. And so it's oftentimes rare to have such a nuanced public health issue, and it's always been quite interesting to me personally. One thing that I'm quite proud of is the real-world impact that our research has had on tobacco policy. For example, the FDA has cited our work on new flavored oral nicotine products in a warning letter to an illicit nicotine gummy company. And that warning letter actually led to the company removing their nicotine gummies from the market. And so it's just a really good example of how we're conducting research that has direct impacts on federal policy. So my favorite part about my research is probably working in a space where we actually have the opportunity to inform policy. In this country, we're seeing tobacco and cannabis policy change so quickly, and so it really provides opportunities for us to come up with research questions that really maximize our regulatory impact. And that's pretty cool because it's not every day that you get to work in an area where you really do have the opportunity to work with policymakers and come up with research questions that can inform policy change.